I want to show you what makes my functional medicine, my lab testing, a little bit different than what you may get from your conventional medical doctor or even from another functional medicine practitioner. I'm going to show you a sample of some of my reports, where they're from, how much they approximately cost, and then that way you can do a little bit more research on my website and see if this is something you want to contact me about to get your blood checked out, to find out what's in your blood. So I'm going to show you one of my reports. This is my personal report. This test I did back in September of last year. This is probably, looking at it, I think this was one of my $200 panels. And when it's $200 to me, it would cost, from what I've been told by my other patients who have taken it to their medical doctor, it costs closer to almost $2,000. Not to say you can't get it from your medical doctor, I'm just showing you the information. So here's what one of the reports looks like. I'll try getting a little bit closer. I know it's a little bit hard. And you can see that it's colorized. It's not your typical black and white report. Anything that is above or below the normal lab values that you get from your medical doctor, they're going to be in red. Anything above, anything really high is going to be in pink, or that's alarmingly high or low. Anything that's outside of optimal range, which is this range right here, this is where I live, where my business for functional medicine, that's going to be in yellow. And as you can tell, I don't look too healthy, do I? So we have some stuff in red, some stuff in yellow. I don't have anything in pink, but we can kind of see that I'm not functioning at optimal levels. Then this report takes it, breaks it down, has different ways to look at it, because they have barcodes, because everyone understands graphs, understands pictures differently, and learns from a different level, and these reports, these functional health reports, really help people with doing that. Then it breaks it down to each biomarker and it explains it, so you don't have to go on Google and be like, oh my gosh, what's going on with me? Anything above, they show the percentage and they walk you through, so it really helps explain, so you have lots of information to go home with. And then you get the functional index report. And I'm not looking too bad when I compare to some of my other patients, when I compare to how sick I was 10 years ago. So with this, you're looking at like, okay, so top thing is immune function index. Well, anyone who knows me knows I have Lyme's disease. It was something I was diagnosed with almost 10 years ago. It's something that my naturopath doctor and I believe I probably have had since 8th grade. It just didn't get diagnosed until many, many years later. So with this understanding, my body, my immune system is always slightly compromised. It'll always show up. It's something that stress levels can trigger to make it worse. I have to work really hard. I have to take care of myself in order to make sure my immune system stays as healthy as possible. So that's, but that's only at 63% dysfunction. Not bad. I have nothing over in the 100% dysfunction. So acid-base index, not eating as well as I should. We kind of talked about that. Then adrenal function index, I might be under a little bit of stress. I think that's something I battle a little bit. So then it breaks it down and it tells you where we get the idea that there might be an immune problem, and it shows you all the different biomarkers and it kind of groups it together. It's not just looking at the white blood cell count and everything. So that's that breakdown. Then it looks at supplements I might be missing. I'm a little mineral deficient, so I've been taking my minerals like I should. And it just keeps breaking it down more. And then it gives recommendations of supplements I should have. And these are just recommendations. And from here, I go over this with my patients. The clinician's copy has another bar graph. It's an extra portion that can help me with a deeper differential diagnosis. I have hypoglycemia, again, something I didn't know, something I'm working on, and that's another constant battle. I've always had really bad hypoglycemia. My fasting blood sugar is way better than what it was 10 years ago. 10 years ago, my fasting blood sugar was 65. Used to crash all the time. Not a healthy way to live. It's doing much, much better. I think when I did this test, my fasting blood sugar was sitting at 80, so that's really good. That's where you want it to be, but I had other biomarkers that were showing up there like, still battling hypoglycemia. So if you decide to order blood work from me, you'll get a report like this. If you decide to go to your conventional doctor and bring me blood tests, I can put it into another program and you'll get a smaller report, but still just as good. It's through FH eval, and we can type that all in. Again, it shows the optimal and the alarmingly high or low, same colors. It doesn't have anything that is optimal and standard. It doesn't have anything in the alarming. So you can see yellow or red, but it will mark it if it's high or low. And then, and this was the same blood test I went over, I punched it into this one. This one put down as the number one issue is anemia, iron deficiency anemia. Again, something I battle most of my life, so it's something that I keep working on. And so I just am like, so I realize I have to keep dealing with that. Got some thyroid issues, again, another condition I keep battling with, but not to the level that I need to be on pharmaceuticals. It's my T3 and T4 are low. So my thyroid has an underconversion issue. And it just goes through. Now this report has dietary and lifestyle applications that people can use on how to eat better. So that's another reason why I like this report. That's why I put it together. Sometimes with some of my more difficult patients, they might get a copy of both reports because we're really trying to figure out what's going on. The third report I have here is my Ancestry DNA report. Pretty cool, huh? This is a way where Ancestry DNA takes all the different genetic mutations. It's a raw data report, and I can upload it into FH evals, and it shows me all the different genetics that I'm missing. I have a lot of genetic mutations. I have a lot of genetic variants. It tells me what I have going on. I don't methylate. I have the MTHFR gene mutation. I have a methylation problem. I have the MRR. My body just doesn't methylate, so I can't absorb B12 from my body or from the foods I eat. I can't make it that way. I have to always take a methylated B vitamin. My liver doesn't properly detoxify, which is why I'm a real cheap date most nights. I also got varicose veins, another sign of the body not methylating. All these little things are indicators when a person is anemic. Their hair will fall out. It's not so much a thyroid problem, even though yes, I have thyroid issues, but they're not severe. My anemia, when it's really bad because I failed to take my B12 supplement, I start having more hair loss. When I start taking it, and when I take it appropriately and every day, I have more energy, my hair gets thicker, and I feel better. Well, everyone knows what anemia does. I have a genetic mutation. I'm always going to be anemic. I'm always going to need to take B12. It's just the way my body's built. There's nothing I can do about it. But it's not a death sentence. It just means I need to take better care of myself. And I am, and I'm doing a lot better. I didn't realize how sick I was 10 years ago when I finally got in touch with a naturopathic doctor. I was doing my own blood work. I could tell I wasn't getting better. My symptoms were getting worse. But I couldn't figure it out. I was going into perimenopause at age 33. I was having cyclical depression every single time I ovulate, every single time I was about to get my period. I went into a bout of depression that would last for days on end. Crying, sobbing, took everything to get out of bed to go to work. I knew how to put on a happy face, and it had no rhyme or reason. It would come on, no joke, right around 4 o'clock in the afternoon. Don't ask me why. I'd be in the middle of my workday, and all of a sudden I was just done. And it was really hard to function that way. It took me almost 2 years to recover, and that was with surrendering my functional medicine to a doctor who had more knowledge and experience than I did. He was a chiropractor who was also a naturopath. He was also certified to do injections, so he was able to give me B12 shots along with herbal and homeopathic injections. I drove about once a month to once every 6 weeks to Longmont, Colorado, which was a 4-hour drive, for almost 2 years for this doc to get me better, to help get me better. I'm not going to say I'm cured, because these are lifelong conditions. Lyme's disease is a lifelong condition. Pernicious anemia is a lifelong condition. But I'm way better than what I was. My anxiety, depression, way better than what it was. But it took almost a year to get over it. Naturopath, chiropractic, massage, acupuncture, mental health, exercise. I had to do 6 modalities to help myself get better, along with thousands and thousands of dollars worth of labs to over the course of 2 to 3 years and further to ensure that I am healthy. And I have to continue on with this. It is not something that I can just ignore, think I'm done. This is an ongoing problem or conditions that I have to keep an eye on. My first year alone, when I was under care of the naturopath in Longmont, I probably spent close to $15,000 on my health alone. That included lab work, that included supplementation. A lot of that stuff I was able to get at cost. And then that doesn't include driving over, hotel rooms, food expenses, and all that. So I can empathize and I understand how expensive this road is. But I'll tell you right now, conventional medicine failed me. They couldn't figure out what was wrong. They looked at my labs, they were like, oh, all they commented on was, oh, you got great cholesterol. My cholesterol, total cholesterol was sitting at 135. Your total cholesterol drops below 120, you increase your risk for cancer. That wasn't healthy. I wasn't absorbing enough fat to make hormones. Why I started into perimenopause at age 33. I had severe leaky gut syndrome on top of Lyme's disease. I have a positive ANA that was homogeneous. Which means my body could flare up an autoimmune condition at any point. Adrenal fatigue, hypoglycemia, like I said, low blood sugar, thyroid disorder, the Lyme's disease. So all these conditions, I can't remember everything anymore. It was 8 different conditions that this doc was treating, along with the anxiety and depression and everything that was going on. I understand. I've walked this walk. I've been down this road of being sick and wanting to get healthy. There is a solution. It may not be covered by your health insurance, but I can help. And it's going to take some work, and it's going to take some time, and it's going to take more than just me. Good news is I can help you, guide you towards that as well. Please don't hesitate to call, reach out, contact me, email me, messenger, however you'd like to ask me questions and see about if I can help you gain back you.